so I knock on the door. Hi, Mackenzie, Shay. My name is Kinsey. I'm going to be your nurse today. How are you doing today?
Good.
Good. So we're going to do a quick assessment of the heart, nest vessels, peripheral, and lymphatics. Do you have a few minutes, or do you want me to come back later?
This is a good time.
Is it a good time? Okay. So before I get started, I do just have a quick few questions for you to answer. Is that all right?
Yeah.
Okay, so do you have any history of smoking?
No.
Good. Have you ever had any cardiac or vascular problems?
No.
Okay. Any leg pain or cramps?
No.
No? Have you ever had any like pallor or issues with respirations?
No.
Have you had any like history of cardiac issues?
No.
No? Alright. Well, everything. Do you drink caffeine? You're pretty young.
I drink coffee.
Coffee? Is it just occasionally?
Yeah.
Yeah.
Once a week.
Okay, that's fine. That's normal. Alright, so I'm going to start with my general survey now. I would have done that right when I walked in, but she's sitting up. Everything looked fine. I didn't notice any skin color issues. So for my inspection, I'm going to be looking at skin changes on the arms and legs first. So Mackenzie, if you don't mind, just lifting your arms out for me. So I'm going to be assessing the different areas, and her skin color looks even on both sides. I don't see any bumps. I don't see any lesions. Her nail beds and her hands don't look like a different color. I'm not noting anything that's blue. None of that. And then I don't see any sores or anything. They all look normal. Her skin does look smooth. I just see a few macules and moles, so nothing that I would be concerned about for this. And then I'm going to assess her chest. On the chest, I don't see any bumps, lumps, any discoloration, nothing sticking out. I can't visibly see any of her pulses. Everything looks symmetrical. And then I would ask, if you don't mind, can I look at your legs and your feet? So her legs, the color looks even. There's no bumps, lumps. Her toenails look fine. They're not a different color. They match the skin tone. I don't see anything to be concerned about. I can't see any visible pulsations on the feet either. So now I'm going to start with palpating, and I'm going to start with her legs. So first I'm going to do the temperature, turgor, make sure that she has blanching, and then I'm going to do the capillary refills on her toes. So I'm just going to start with the temperature. My hands may be a little chilly, I'm sorry. The temperature is warm. It's even upon her whole body. Her toes are a little colder. Are your feet normally cold?
Yeah.
Yeah, I figured. She does have blanching, which is good. And then you're gonna feel me press on your toe. So I'm assessing the capillary refill. Took less than 2 seconds. So that's all good. And so now I'm just gonna do the same thing, but on her arms. And so I'm gonna assess the temperature, both sides. It's warm. There's no changes in the temperature, nothing like that. Blanching on her arms. And then I'm going to check the capillary refills. Less than 2 seconds, so those all look normal. And so then I'm going to, you can lay those off for 1 second.
Oh.
I'm sorry. I'm going to start palpating her pulses. So I'm going to start with the feet, that way she can put her pants back on as soon as possible. So you can just put your leg up here if you want, and I'm going to wipe it off with an alcohol pad. So I'm just going to clean the general area where I should be palpating the trash. So for this pulse, I'm going to feel around. It can be really anywhere from this area and so I feel it, so I would count the rate. and the rate was 70, and I would grade it as a 2+. So now, if you don't mind, I'm gonna check both feet for the pulses. And I would have wiped this foot off too, but I know my feet are clean, so I don't mind touching them. And they're equal on both sides. I would say they're both a 2+. And so now I'm going to move to the pulse behind the knee. This technique worked best for me to find hers. I struggled finding it on the other one, so. And I found it. It's a little weak, but it's not, like, it's still strong. I think it is just kind of the area where it's at. And so I'm gonna feel the other side. And so I'd grade that one a 2+ as well. And if you just relax. And I have both hands here, but I'm only feeling it with one hand. I just have the other hand to kind of help me hold it up. And I would say that this one's a 2+ as well, so I'd say that they do have equality. So you can put your pants back on if you like. So I'd be documenting all this. But I am gonna do your other one right here. So for this one, we're feeling right behind, and it's on the big toe side. It's a little harder to find. There it is. Okay. And so then I would check the other side as well. And I'm gonna go same thing, big toe right behind. And I would rate both of them a 2+. I would check for equality, but they both felt equal upon the assessment. So now I'm gonna move up and start the heart. So there's a few different things that I have to do to start. First, I'm gonna do the assessment for thrills and heaves. And so I'm just gonna place my hands on my landmarks and make sure I don't feel any moving up or any thrills. So I'm gonna start with the heaves. So I'm gonna go parallel. And they don't move up or anything. I'm gonna go like this. I don't feel any. I'm gonna go kind of down here. And they didn't move up, I didn't feel any throws. So next I'm gonna go to just palpating the areas. And so the first landmark I'm gonna do is the aortic. And so I like to find our sternal notch. And then I feel the bone, and I'm gonna go down into that space so I know that I'm in my second intercostal space and I'm by the sternal board, and I'm palpating. And tell me if you feel any tenderness or anything. No. So then I'm gonna go straight over to the other side, and this one is my pulmonic. Any tenderness, pain, nothing like that. So now I'm gonna move down to the third, and this is gonna be the herbs. And any pain. And I'm just gonna keep working my way down. I'm not gonna do this part for the video, but I'd be feeling the fourth space, which hers is a little lower, and I don't wanna make her expose herself for the video, but it would be the tricuspid, and I'd palpate it and ask her for any feeling. I am gonna do the fifth mid-clavicular. So this one's the apical pulse, and I'm going to not only feel it, but I'm also going to calculate it. So I like to find her angle, walk my hands over, and then I know that that's the 5th, and I want to go up into that space. And there it is. So then I'm going to start counting. And I got 68 for that one. I would rate it a 2+. It felt pretty normal. There was no arrhythmias or anything like that. I didn't notice any speeding up or slowing down throughout the period. So now I'm gonna get ready for auscultation, and I'm gonna make sure that I clean off the ears of my stethoscope and the belt and diaphragm, since I'll be using both. I'm gonna start by cleaning off the diaphragm, and then cleaning the bell and ears. Alright. So I'm going to be using the same anatomical landmarks that I used for palpation for listening. So I'll start with the aortic, which is, I'm going to find her sternal notch. That's the bone, and I'm just going to go down right in there to that space. It might be a little cold. And if you just don't mind breathing in, on the exhale, hold for me. Alright, so I felt the love dub there. So I'm going to move on to the next, which is the pulmonic. And breathe in and then hold. Same thing, that one, loved up, didn't hear anything abnormal. I'm gonna walk into the next space. Same thing there, and then I'm gonna walk down just one more. So. Over there, and then I'm going to go back to the apical. Alright, and so since I'm already here, I'm going to switch to my bell side, and I'm just going to listen again. And here I should be able to hear the S1 and S2 equally, so I'm going to assess that. And I can hear both of them equal, they sound the same. So then I'm just gonna work my way back with the bell. Alright, and all of those sounded normal. I could hear the S1 and S2. I just heard a lub dub. I didn't hear any whooshing, didn't hear any extra clicking sounds, nothing like that. So next I'm going to move on to looking and assessing the carotid artery. So the landmarks I'm going to use for this are the sternal cleidomastoid, and then I'm just going to kind of move down because we know that it moves at an angle kind of towards the trachea, and I'm only going to assess these one at a time. And I'm going to palpate and feel any tenderness. I don't feel any lumps or any bumps, nothing like that. And both of them felt strong. I could use that to compare the heart rate if I assessed it for the full minute. For this next one, I would have her sitting in the bed, but for our demonstration purposes, I'm just gonna verbalize what I'd do. So I'd move it to 35 degrees, and then I'm gonna have her kind of turn her neck, and I'm going to assess with a pen light the veins.
It's right there.
And so I'm gonna shine the pin light on it, and I'm just looking at the veins, looking for any engorgement, looking for any visible pulsations, which I can't see any. And then I'm gonna do the same on the other side, looking for the same things. And I don't see any visible pulsations or anything like that. And so I'm going to end with finishing up just on my brachial pulses and then my ulnar and my radial. So I'm going to assess these for the full minute. Well, that's 69, so now I'm going to feel the other one. And I'm going to compare the two. And I would say if they were equal, and I would rate both of them a 2+. So next I'm going to move to the radial. And these two are already equal, and I would rate them both a 2+. I would assess for the full minute. So then the next test I'm going to do is the modified Allen's after, and I'm just seeing if I can feel her ulnar ones before we do it. And I can. They both feel pretty equal. So this next test I'm going to use, so if you're going to do like an ABG or anything to the radial side that would occlude the vein, we want to make sure that our ulnar side is able to adequately perfuse as well. So I'm going to start holding your hand like this, and I'm actually going to occlude them, and you're going to have to press down pretty hard, so let me find them first. Alright, so I'm going to press down. And what we're looking for is once we occlude them, her hand should start getting lighter and it should turn slightly purple. And we're just going to hold it there until we see it. You can relax your fingers if you need. You feel any tingling? Not yet. Might have to press down harder. And so you can tell her hand's starting to get a little lighter, so I'd keep holding it. And her fingertips are starting to get a little purple, so I'm gonna go ahead and let go of this side and keep this one here. And you should be able to start seeing, you can tell her color's starting to come back a little bit. And so that means that the ulnar side does let go equally. And that's all I have for my assessment today.